Thank you for joining us for this video on managing your emotions following a cancer diagnosis, sponsored by the HSC Spark Innovation Program and the National Cancer Control Program. Dealing with cancer can be really challenging. There are a lot of different supports available to help you navigate this difficult situation. You don't have to deal with this alone, and we want to help support you. There are nearly 40 regional and national cancer support organizations that are part of the Alliance of Community Cancer Support Centers and Services. The Alliance is an initiative of the National Cancer Control Program, also known as the NCCP, through the HSC, and ensures that these centers are offering the highest quality services to meet the needs of people navigating cancer.
I found that going to the psycho-oncology myself, that it was the only safe place I had to talk to someone without fear of impacting them. Everyone else in my life, if I spoke to them about what I was going through, I could see from their reactions how much that it was upsetting them. So it was the only place that I could go, that I could speak completely candidly, completely honestly, and not feel like I was going to impact that person.
You're right, you go to like a professional and you have this kind of safe space where you can unload, but at least they have the skills to talk around it and bring you out of it.
Their profession is there to support you, to guide you through it and give you the things and the tools that you need in order to help yourself through it.
It provided me with a safe space whereby you had a professional not minimising what you were going through and saying, this is actually quite a normal reaction of it.
The services offered are different from center to center, but include essential help like cancer information and advice, nurse support, physical activity programs, reflexology, social activities, well-being classes, grief support, one-on-one counseling or life coaching, and practical help like wig, bra, and prosthesis fitting, and financial advice. These services are offered free of charge and provided by qualified professionals dedicated to supporting people with cancer. Ask your treatment team to connect you to your local support center. The NCCP and the HSC also provide specialist services to help manage the challenging emotions that can come alongside cancer. This specialist service is internationally known as psycho-oncology and covers a whole range of difficulties experienced by people with cancer, from adjusting to a new diagnosis to dealing with psychiatric disorders. The NCCP and HSC have been hard at work growing psycho-oncology services nationally over the last few years. There's now a psycho-oncology service in all the major cancer specialist hospitals across the country, although each team looks a little different. All the teams are made up of different healthcare professionals. Most of them have social workers, nurses, psychologists, and psychiatrists on the team. The psycho-oncology service usually meets with people who might need support outside of or in addition to a community cancer support service. All the professionals within the psycho-oncology service work together. Sometimes you meet with one of us or with multiple people on the team. All of us want to make sure that you get the right kind of support so you can effectively manage the challenges that come alongside cancer. Many people are referred into the psycho-oncology service and find it really helpful.
Hi, I'm Helen Coughlin and I am a social worker in the psycho-oncology service at St Vincent's Hospital in Dublin. Social workers on the psycho-oncology service support patients and their families and other loved ones, friends and others to help manage and navigate through all of the psychological and emotional aspects of having cancer. Social workers work at different levels. We tend to take quite a broad view of people within their families, their networks, their communities. So we might work one-to-one with you as a patient. We may work with somebody in your family to give them support. If you're part of a couple, we may see you as a couple or see your whole family together. You might also work with a social worker as part of a group that includes other people who may be dealing with cancer in some way. So our background means we are, I suppose, experts in some ways in seeing things with a kind of big picture view. So we really understand that there are many, many things that affect people's lives, both related to cancer and outside of that. What we try and do is help you get connected with services and supports outside of cancer and treatment that might also help you focus on your health.
Hello, I'm Eugene Byrne and I'm a clinical nurse specialist in the psycho-oncology service at St James's Hospital, Dublin. Clinical nurse specialists in psycho-oncology also support patients in managing the emotional impact of a cancer diagnosis through one-on-one and group sessions. Clinical nurse specialists provide psychosocial intervention, connect to other services, provide education, and may sometimes prescribe medication to help you manage your symptoms.
Hi, I'm Natalie Hessian and I'm a psychologist in the psycho-oncology services at Galway University Hospital. Psychologists in psycho-oncology help patients with their psychological and physical challenges. This can include adjustment to your diagnosis, management of anxiety or depression symptoms, coping with changes in your body or relationships, or managing physical issues like insomnia and fatigue. This is usually through one-to-one psychotherapy using a range of different psychological approaches. You may be referred to a psychologist if you're having symptoms that aren't getting better with time or aren't getting better with other types of support.
Hi, I'm Paul Matthews and I'm a psychiatrist in the psycho-oncology service at the Mater Hospital. Psychiatrists in psycho-oncology are doctors who specialise in the medical management of psychological symptoms arising from cancer and cancer treatment. We particularly focus on severe mental illness, the management of psychiatric medication, and psychiatric symptoms that might be caused by cancer, its complications, or its treatment. This might include people who already had significant depression or anxiety before their cancer, or those who develop these symptoms during cancer treatment. It also includes people who have a diagnosis of serious mental illness, like schizophrenia or bipolar disorder. Psychiatrists also manage the psychological effects of physical illness, such as delirium caused by infections. We can recommend or prescribe medication and also give advice on changes to your cancer treatment that might help your symptoms.
Thank you for taking the time to watch this video on the available supports to people navigating cancer. If you're struggling after a cancer diagnosis, please don't struggle on your own. Talk to your treatment team and ask them to connect you to the service that best meets your needs.